Welcome back, everyone, to another edition of the Prove Me Wrong podcast. It's a paranormal edition today. I am your host, Pete Lieb. I'm glad you're all on board with me. We have an absolutely fabulous show lined up. So good, in fact, that Christina has decided to join me today. Welcome, Christina, back to the podcast.
Hello.
She doesn't sit with me all the time, folks, only on the special occasions. This is one of them. So if you have ever listened to the podcast before, if you're a regular listener, you would know that I have mentioned on previous podcasts to anyone who ever looked into my general direction, anyone who's ever talked to me, that I am really worried about the thought of afterlife and dying. I will live and try to live as long as I possibly can. If that means replacement parts, sign me up. If it means cloning me at some point, take my DNA. Anything short of uploading my brain into an AI system, I'm really kind of here for it. Because I'm worried, bottom line, I am personally worried that maybe there is nothing else, that what we have here today is all that there is, and once it's over, that's it. I mean, it sometimes keeps me up at night. I know Christina sleeps like a baby. She couldn't care less. She knows that at some point she's going to die. Well, I need something more than that, unfortunately, and I don't know what that is yet, but maybe our guest today will help, hopefully to give me some comfort. And our guest is Dr. Laurin Bellg. Laurin is a medical doctor and author of the book Near Death in the ICU. Through her work in the ICU, Dr. Bellg has been present bedside for critically ill or dying patients, and some of them have shared with her some experiences that they have had during those moments of crisis, and sometimes even seeing beyond our physical world. So maybe she is going to talk me off the ledge a bit and share some of that knowledge with us today, I hope. You can find Laurin online on her website, Laurin Bellg, BELLG.com. Welcome, Laurin, to the Prove Me Wrong podcast.
Thank you. I'm so happy to be here.
So I'm very happy. I'll be honest, I'm very excited that you're here, because this is an ongoing thing between Christina and I. And she always thinks that I overreact quite a bit, but that is a fear of mine. But before we get into some of your experiences, can you start us off with just a little bit of your background and why you decided to go into medicine? What was it about?
Well, sure. Yeah. I mean, I am intrigued by that living edge of being alive and human, but also being kind of on the edge of risking death. I think we all kind of fear that. And, we all have experiences that connect us to what it is to be human, and being in medicine was one of mine. And I could not be involved in being involved with medicine and helping people at that fragile edge of being human. And once I kind of connected with what it was to be a doctor, to be a nurse, to be a paramedic, anybody who kind of works in that environment, once you touch that, you can't step back, because it's really, it draws you in. And any of us who are connected with those very questions that you raise of being afraid of death, to kind of move in that environment and just be connected with that is really, it's kind of addicting. And as macabre as that may seem, it's also kind of beautiful, really, because being in that space with humans who are scared of dying. I think we're all scared of dying, but who are also kind of scared of being alive. I think many of us are in that space too. Once you are kind of drawn into that, it's kind of magnetizing and you can't step back. And that's where I found myself.
Do you remember the first experience that you had with a patient, in that situation where maybe they had a near-death experience? Do you remember the first time that happened to you?
Oh, absolutely. And that is what has kind of pulled me forward, because I can't forget it. In fact, I had an experience with a patient and didn't understand it. And I think that was that curiosity that was the glue that kept me engaged. And the moment I remember was someone who actually saw his surgery in a way that I knew was not possible. And when we know it's not possible, that's what draws us back in and keeps us curious. And I remember a patient who explained to me something I knew was not, it just couldn't possibly be. He was a patient who was dying, who had surgery. And after his surgery, he said he would never do that again because he saw it. He was engaged with it. And the way that he said that he saw it and experienced it as a very physically grounded person, I knew that wasn't possible for him to share with us what he said he saw. But at the same time, I was intrigued. And unfortunately, this patient continued to decline and pass away because he had an experience where he was so afraid of what he saw that defied really explanation, that he declined any further medical intervention, and then he died. And that bothered me. The fact that yes.
So he just refused treatment. He would rather die than have another surgery.
Well, he saw his surgery, and that was what was baffling to anyone who was around him. He said, I saw my surgery, and we knew that was not possible. But when we kind of untangled his story, he described to us something we knew was not physically possible. And because of that, he said that he would rather die than engage in a surgery that he was actually able to see, which was kind of strange to us, but that intrigued me and kind of pulled me forward.
So did he say that he was above himself, or that he saw himself being worked on, or was it some type of astral projection?
Yeah, and I'm not really sure what it was, but he was able to say that he saw his surgery outside of himself, and the people who were involved in his care at the time said that was not possible, which I took issue with because that shut him down. And to tell someone it's not possible, whatever they've experienced, even though I didn't know what was going on, instinctually, my gut reaction was not to shut someone down, but to be intrigued and try to understand what it was that they experienced. So this particular patient said that he described perfectly his experience of surgery, which he should not have been able to do. And describing that, he was able to not only tell us what he saw, but also disengage himself from any potential of healing because it was too frightening for him. And shame on us for not being able to untangle that for him and tell him that, this is a normal human experience, but he was too frightened by it.
Yeah.
He disengaged from it, and then unfortunately he died. But that was the gift. The gift in that for me was being able to kind of pull me into the process to help other patients by his experience.
Is that when you sort of took the initiative to start saying, I'm going to begin collecting these experiences? Were the experiences in your book all yours, or were they experiences that you collected from other doctors, other patients?
Oh, they were all mine. Yeah, they were all mine. And absolutely, that was that was the pivot point for me, because I felt in some way responsible for the fact that he passed away because he didn't know any other option. I feel like if I'd been able to say to him, this is something other people experience, it's an extension of the human experience, it's not that strange, it's not that unusual, he might have lived. But the burden of that was so great on me that I felt compelled to explore it further. So what I share in my book are experiences that I've had with patients over the past 20 plus years.
Did you start from a place of spirituality? Were you spiritual prior to this? Did these type of experiences strengthen your faith or give you a faith that you didn't have previously?
Sort of. Yeah, I came from a very traditional background of spirituality. I'm the daughter of a minister. There were things about that, though, that didn't sit quite well with me, that didn't ring true.
Yeah.
And just trying to kind of find my way through what it means to be human and spiritual, being a medical doctor and having the gift of people sharing with me their near-death experiences, that really has brought me back to a place of faith, honestly.
No doubt. I mean, I think it would have to. Right? I mean, right? Are there any consistencies in the experiences that you have encountered from patients, or are they? I mean, in terms of the experiences that are had, or are they just kind of more personal or more specific to each person? Are there things that you hear a lot of?
Oh yeah, I mean, I think there are some similarities. I mean, I think, as I step back and try to understand for myself what's going on, I mean, I think that there are some similar experiences of being a bit disconnected from being human and kind of floating in that spiritual space that people interpret in the same way, but through different spiritual lenses. In our place, in our area of Wisconsin, we have a lot of Hmong patients, so people who are dislocated from Southeast Asia in the 1980s during the Cambodian genocide. We were second from California in accepting the most refugees here, and that's interesting to me because when patients of the Hmong tradition die, they enter a very ancestral spirituality that sounds very, very similar to the Anglo-Saxon Christianity spirituality. I mean, the things that they describe in that space of dying is not dissimilar to what the other faith practices or other cultural practices define. And that was really important to me to understand that maybe dying is a human experience and not a spiritual one. And we interpret it through our spiritual lens. And that really has been pretty fascinating to try to sort through.
So how did you collect the stories themselves? Were the patients interested to talk to you about it, or did you have to overcome some resistance at first?
Yeah, I mean, sometimes. I mean, I think I have come to believe and realize that people are always wanting to share things. They're just looking for an invitation. And the unfortunate side of being a physician is there are very strict guidelines for how to communicate with patients, how we should communicate with patients. And honestly, I think that more often than not, shuts people down. So in the past, over the past 20 years, I've tried to figure out ways to navigate that gives patients permission to share their stories. And I think they want to. I think they want to tell them tell us what has happened to them. Interesting to me is I found that patients were talking to nurses and respiratory therapists, ancillary staff, physical therapists before they were talking to physicians. So that kind of made me wonder, what are we projecting that shuts them down?
Well, do you
tells them?
Yeah, I mean, do you think that it's more of they typically have the more personal relationship with patients? I know the times I've been there, the nurses are the ones that really have the relationships with you, and the doctors come in.
They are the power.
Yeah, they come in and look very official, and they look at my chart and they tell me, okay, everything looks great, and they walk out. But it's that nurse that's there.
Yes, the nurse is there. And what about what I project shuts them down? That's really unsavory to me, and something I started exploring. And you're right. The nurses are there. They're there for their 8-hour shift, their 12-hour shift. They're there in a way that tells patients that is safe space to share what has happened to them. And my question became, what in how I interact with patients can tell my patients that I am safe space, so they can share with them what has happened and not be shut down.
How did the other doctors welcome that approach? How did they take that? Were you open with the fact that you were in there trying to collect these different stories?
Yeah, not initially, because I don't think that it is safe for us. It's not safe. We have not made it safe for physicians to explore other options in our current practice, which is unfortunate, because in the past, when it was more of a kind of earth-rooted, homeopathic type approach to being human, maybe even 100, 150 years ago, this was pretty normal to kind of talk about things that you can consider and to be a bit spiritual. But I don't know. I've had the great fortune of being in the same place for almost 20 years.
Mm-hmm.
This was my first job out of training. And I have built a relationship with the people around me, the providers around me. And when my book came out, I was a little hesitant, but kind of surprised at the response. And I think one of the best responses I had was when one of our surgeon staff who is a bit dour,
Mm-hmm.
actually came to me and seemed to be a bit secretive and looking this way and that, kind of approached me and said, hey, I read your book and it's true. I had an experience, and it was clear he didn't want anybody else to know. And, this was a surgeon that people were a bit afraid of, including me. And so whenever he came up to me, I was a bit intimidated, but, as I let him kind of, share whatever it was he had to, it became clear that he was so kind of entrenched in the medical persona, in part because he had a near-death experience when he was 14. And he kind of affirmed for me that in our current medical environment, it's not safe to share these strange experiences and be considered a good physician. And that's troubling to me, actually.
Why do you feel that is? Because to your point, you just mentioned it used to be that the whole process of healing was extremely spiritual in nature. There were a lot of things there holistically. Here, let's rub some dirt on this, or let's rub some herbs on that, or take this, root. It was a much more spiritual practice. And I get that as science has gotten better, as processes have improved, as technology has improved. Why have we then legislated out or kind of practiced out all of the faith piece of the healing?
Well, historically, I kind of get it. I mean, we, as a Western society, have kind of struggled uphill against kind of a voodoo type consideration of medicine. Mm-hmm. And, with the scientific revolution, we have tried to separate medicine from superstition. And in the past, it has been so grounded in superstition, and we didn't have a problem with that. But as we become more scientifically oriented, it's become uncomfortable for us. And I actually think that we are seeing more a move, albeit very slowly, back toward a combination of both of those, that we are spiritual, we are superstitious, we are also very scientifically grounded. We're all of those things. And I think, we, over the past 100, 150 years specifically, have really kind of struggled to incorporate both of those identities. But I think it's coming full force because, in most hospitals, you'll hear some language not only of scientific groundedness, but also of spirituality. And mm-hmm. I think that's heartening.
Well, I mean, I know personally, I think that a person's faith has a whole lot to do with their recovery. And just as much as, the doctors and the nurses, they do their job and they put their science behind it. But then that person also has to believe and have faith in the fact that they're getting better and they're going to improve. And I think they both work together, to your point. Are there any, without giving away everything in your book, because I obviously want people to buy the book and read the book, what are some of your more interesting, or can you tell me one or two really interesting experiences that were told to you?
Well, actually, since I've written the book, I continue to have experiences presented to me, and maybe it's because the book kind of ushered in an invitation for people to share.
Sure.
But recently, probably about 6 weeks ago, I had our office get in touch with me saying that, someone wanted to share an experience with me. And because I put the book out there, I feel like there's a responsibility for me to follow through in whatever ways that people want to come forward with that. So I was given a phone number I called the person, and they shared with me an experience of being near death, and I was able to, with their permission, look up the chart, because in this day and age of being very kind of constrained by legal
Right.
rules. So I looked up their experience, and it was not even someone I had been involved with, but it was someone who had been deceased, legally declared dead, and their heart had stopped. They had been declared deceased. It was futile, walked away, and then someone had been called back saying there are signs of life. And, what was interesting to me is that this patient who, wanted to share their experience with someone who would listen, even though I had never been involved in their case, was able to share a bit of anguish, actually, at someone kind of throwing in the towel professionally, that they had been declared deceased, had been worked on, had CPR, they had chest compressions, medications, the whole thing. And because it had gone on too long, and I think there's some scientific viability to being able to say, if you've kind of worked on someone for 30 minutes, 40 minutes, and they've not come back, chances are they're not going to. What was interesting to me about this case is this patient had heard them say, after about 30 minutes, we've reached the scientific edge of what it is considered acceptable. They're not coming back. I think we've done our best. And they had. We declare them deceased. Mm-hmm. And what was interesting to me is that this patient was really kind of traumatized by the fact that we met the scientific standards and walked away. And this patient, there was something of their consciousness that said, I am not a scientific standard. I am not ready to die. There's still things I have to do. Please don't let me go. And it was heart-wrenching to hear that this patient had their consciousness actually had the ability to kind of scream out in ways that we couldn't hear, wanting to pull us back and say, not give up. And that was really, it was kind of troubling. It was exciting. It was heart-wrenching. It was all of those things that made me wonder, do we really know what we're talking about when we set these guidelines for what is enough to continue to try to hold people on this earth? And I don't think we know the answers.
So Dr. Bellg, without infringing on any confidentiality, was that person's name Pete Lieb? Because that would be exactly what I would have a sternly written letter if that happened to me. I'm telling you now, I would be admonishing someone, because that sounds like me all day long.
It was you, and now that we've kind of gotten that,
I'm telling you, you were like telling my story right there. I mean, that seems like that it would be exactly how I would feel. It's like you need to keep trying until
right.
You absolutely, until you get tennis elbow from the compressions. It's something
exactly.
has to. I mean, but let me ask you this then: is there any truth, or how do you feel? Because kind of going along that, it kind of ties in to the idea that your mind, in some of these situations, your brain hasn't died yet. Your heart might have died, but you're compressing the body, the chest. You're still pushing blood through the body. You're still potentially feeding that brain a little bit. Is there any truth, or do you have any? What are your feelings on that? Maybe these near-death experiences are simply the random synapse firing of the dying, oxygen-starved brain, but you still have a slight consciousness there?
I don't think we know.
Yeah.
I don't think we have any clue, really. I mean, but I think that those of us who are curious grab onto any bit of that we can, because it's electrifying for any of us as human beings to try to understand what consciousness really is. And it's, to kind of try to delineate it as black and white, and we are a very strict definition of consciousness, and that really leaves us all feeling uncomfortable. And I think that we just really don't know. And because we don't know, we have to keep trying. We have to keep kind of grappling at it to understand who we are.
In situations, let me ask you this also. In those situations where you were actually physically present, and Christina can probably speak better to this than I can because she's had it happen to her a couple of times. Can you actually feel when somebody passes? In your experience, have you been able to feel when somebody passes away?
Sort of. I mean, I would never say that to my colleagues, but so over 20 plus years of being a physician, there is a kind of place that I feel, and it for me, I define it to those who are willing to listen as a lack of humidity or the presence of humidity. Mm-hmm. And for me, it is that very subtle space of being an arid environment or a humid environment. And, that's where I really struggle to kind of find the language or the description for what it is that I'm feeling once I've decided to pay attention to it. And deciding to pay attention, I've noticed things. And one of the things I've noticed is that if there is the absence of human spirit, of human consciousness, of human presence, it feels very arid, it feels very dry. And if there is the presence of it, if this patient is meant to be here and is meant to survive, it feels very humid. It feels very occupied, for lack of a better word. And I think that, we don't even have the substrate to really fill that space with definition. And so we struggle to kind of identify when we feel that the patient is present or departed. And those who have done it enough, have done it a lot, probably understand what I mean when we say there's nothing here to salvage or let's keep going.
Well, I know, like I said, Christina, I don't know if you want to tell your particular instance.
Well, there's been a couple, but one was my grandmother. I was in the room when she passed, but I was looking at my mom and we were talking, and I just knew at that moment. I said, "Mom, here she goes," and I, ran over to the bed and I whispered in her ear that I loved her, and it literally was her last breath. And you could feel. You're right. There's a space in the room that suddenly is now bigger than it used to be. It's like it's an energy of some sort, and you can just feel it leave. I mean, it's not. She's right. It's not really words for it. It's hard to tell, but it was just. You could just tell she just wasn't there anymore. It was just a body.
And I hear you struggling with the vocabulary, and I really connect with that.
Yeah, it's difficult.
You cannot find the words to explain what it is to define presence, absence of presence, and movement of presence leaving the room. Yeah, it's really hard to define.
Not everybody feels it either, because my mom was like, "You're crazy. How did you know that?" I mean, I had been sitting with her she was in hospice, and they had told her for several hours that, it could be at any time, and my mom had been sitting with her all night, and I literally walked in a half an hour before, and she's like, How could you know? I've been sitting here, for 48 hours with her, and I couldn't tell. I looked at her several times to see if she was still breathing, and it wasn't that I even needed to look at her. I just knew.
Right. And I think that there are people like that, and there's not just, I wonder if that's just kind of a sensibility that we are born with. People who are good at math, people who are not, people who can kind of, tell a story, people who can't. Is it an innate sensibility to determine the presence or absence of people? I don't know.
Yeah. I don't know either, but yeah, I've been able to do that. I've actually done it from far. My other grandmother passed. My father called and said she had a stroke. And while I was driving there, it was like I felt her presence in the car, and I said to myself, "You didn't have a stroke. She passed away." And when I got there, my dad was in such denial. She had been gone for a really long time, probably 3 or 4 hours before they noticed. So he was just in denial. But I knew even before I walked in that door that she just wasn't here anymore. Right. And I don't know if that's just like a connection because I had, we were close or whatever. But I just knew when I walked in that door that she just wasn't even going to be here. It wasn't.
Yeah, I mean, it's hard to describe. It's hard to define. I'm not sure we'll ever know really that. Yeah, I mean, maybe you were close. I mean, I've had experiences where people were, we have a housekeeper who, I mean, a cleaning lady in the ICU who was very, very sensitive. And over 20 years, I've kind of learned to pay attention to her because she has no connection with some of these patients. Mm-hmm. And she will kind of look up, and she and I, over especially the past 5 years, have established a connection. And she'll kind of point to me and say, pay attention to that one. They won't be here very long. And wow. I have no scientific way to corroborate why I pay attention to her, except that she's pure love. She has no agenda, and she is not connected in any way that matters to these patients or their outcome. But she has kind of become part of my patient care regime, for lack of a better word. So she, is just in tune in a way, Christina, that maybe you're in tune with, those people that you love, that you're connected with. I mean, I think some people are plugged in, some people are not. And, if we can pay attention to people who are plugged in, I think that people around us are served by that.
Mm-hmm. Yeah.
So you said something just a few minutes back before she was telling her story that kind of caught my ear a bit. You said still not something that you would tell your colleagues.
I was going to say something
right?
about that too. Yeah.
And so
yeah, no.
And so at this point, it seems to me like you have built your rep now, right? Your book has come out, and people know you and know what you do and know what you're collecting. It seems like you would be able to be more open now with your colleagues than before. Is it still kind of a no-fly zone?
Yes and no. I mean, I had a really interesting invitation about 6 months ago where the emergency room personnel invited me to a book club to talk about the book. And I was really surprised by that, but it was really touching at the same time, because when I've decided, my priority is to provide good patient care, mm-hmm. first and foremost. And that is my commitment, and I stand by that. But I have this extra sense of what's important to people, to patients, to their loved ones. But what I heard from this book group when they wanted to talk about my book was, you've given us an invitation and a challenge to think about people differently. And when I asked them what they meant, they said, people come into our ER and we're pumping up and down on their chest, they're dying. And now, after reading your book, I think what I say at the bedside matters.
For sure.
And that's what they took from it. That's what they took from it. And I, honestly, it made me want to cry. I'm like, if that is all that you got from it, what you say at the bedside matters, I'm really excited, because who knows what patients can hear. Everything is important. When you're thinking in terms of that living edge of living and dying, because we don't know. And if, all they got from it was, I need to pay attention to what I'm saying, what I'm joking about, whatever black humor I bring forward, I need to be conscious of it, because there is a living human spirit in this body. I'm not just a body mechanic. I am someone who is attending to human existence. And that's what I heard them say. And I thought that was incredibly meaningful. So, I continue to go about my work and, providing the best care I can for the patients, but in feeling that I had something important to contribute to the medical community, every now and then I hear it come back to me that what I said has an impact, and that means the world to me.
Yeah. Do they try to, and because you said spirit, and so I'm latching on to these things. Okay, that I'm taking from that you do believe there is a spirit. It isn't just
absolutely
a collection of chemicals and electrical impulses.
That's what I was going to ask.
Go ahead.
Because you said your colleagues and stuff. Did they try to explain it away like that? Is that why it's taboo? It's all scientific. It's all medical, and that's why they don't talk about it.
Yeah, I think that, in our current environment, it is very evidence-based.
Okay.
That you whatever you can prove by research that's what's real. But, I do believe in spirit, and I continue to talk about that. And, I have the good fortune of being in the same place with the same colleagues that I've been for, almost 20 years. And there's a part of me I think they kind of take in stride, but there's a part of me that they respect. And I'm kind of holding on to that, hoping I can push this narrative forward as far as I can, because, I do believe we're spirit. I do believe we're spirit having a human experience. And I happen to be, a physician who deals in, body mechanics and keeping people here on this earth. But for what reason? I think that, we are all here for individual reasons. And honestly, that has become the greater purpose that I serve is, I'm happy to keep you alive, but what is your greater purpose for being here? That's what I'm really interested in.
So you had also mentioned about what you say at the bedside. Can you give me an idea of, have you ever talked to loved ones or those other people that weren't the actual patient, the family of the patient? How have they taken these stories if they've been told? How do they take that?
I think
do they take it in a positive way?
Yes. I think it's comforting. And the more I hear from patients' families, the more I push the edge. I think we all would love to hear that when our loved one is dying, to hear, stories of affirmation, that, stories that are comforting. I think that, honestly, on a day-to-day basis, my priority is to do the medicine that I know how to do, and to find every opportunity to comfort people, families, their families and patients. I comfort them in any way I can, and in any moment that the truth wants to bubble up, my priority is to honor that truth, and it has never failed me. It has never failed me to be able to tell patients, families, what I sense, my suspicions. I think that people in times of grief are looking for, something to hang on to. And the fact that I can share my truth of my experience with their loved ones, I have never had a problem with that. And I think that, providers at the bedside who are reluctant to share that, that saddens me. But I think across the world, the more I share and hear stories from patients, I think that, in those quiet spaces where patients and their families are troubled, the human side of us wants to come forward and comfort them, and they do, and patients are, and their families are, they benefit from it.
I think so too.
Mm-hmm. No, I don't disagree. Have you maintained contact with any of the individuals that you've collected these stories from? I mean, how were they changed by what they saw?
Yeah, sometimes. I mean, I don't make a point of it. I mean, I make my information available so that if they want to talk to me about it, they can. Probably over, especially the past 10 years when it's become more important to me. I have a card that I hand out that, if they want to share anything, they can. And it's a, a neutral, safe space where they don't feel obligated to connect with me, but if they wanted to share their story, they can. But I think that, things that happen to patients, the things their family experience, they do want to share them. And so providing a forum for them to be able to do that is, it's of service to mankind, really. And I think that, it's probably happened for millennia. It's just we've become so constrained in, the past 100 years or so that we have, we have rules and regulations that we feel confined by. But, 200 years ago, they were just stories that we shared around, a dinner, around the fireplace. And now it's, become a little, too bogged down with rules. But I think above that, people really do want to connect and they want to share their stories. And I still get, I get letters that are sent to me by mail. I get emails that are forwarded to me by staff. And that tells me that people are really just wanting to express, that part of themselves is incredibly human, and they want somebody to listen to them.
So have you ever received a story, or someone told you a story that was just so fantastical that you were like, this can't be? I mean, or do you just take every one at face value?
Yeah, no, not really. I mean, there's a part of me that's just so intensely curious about what it is to be human and what it is to be spiritual that whenever someone reaches out to me to share a story, I'm like, oh yeah, that's what we're talking about. I've never, I'm always surprised and amazed, and I hold that sense of wonder, but I think I'm always looking for it. So whenever it comes, and I do invite people to share, whenever it comes, I feel not that sense of disbelief and being gobsmacked, but I feel, encouraged and elated that my suspicions about what is true is actually true.
Do you have a specific instance where somebody was really positively changed, either mentally or physically, by their experience? I know you talked about the guy who was negatively impacted to the point where he would not take any more care, but do you have an experience of the other way that you could share?
Well, sure. I mean, I recently actually experienced receiving a letter through our office, and I remember this case in vivid detail, where we actually worked with this man for several weeks to try to get him better,
mm-hmm.
and get him back to a state of experiencing physical life in the way that was acceptable to him. And we felt accomplished that we were able to kind of work him through his physical ailments and get him back and get him to a point where he was able to move on to rehab. And he actually was able to rehab and get home to, back to his home. And then he died. And I didn't know that, but his daughter emailed me and kind of explained, outlined the timeline that had progressed after we had discharged him from the hospital to rehabilitation, and said that, talked about how he had lived into this particular moment that was important to his family. It was the wedding of a grandchild. And, the day after the wedding, he died. And, what she emailed us was that, her gratitude, the family's gratitude, that we had actually pulled him to a point that he could believe that he could be present at this wedding, which was his dying wish, to be present for this granddaughter. And he made it to the wedding, and died shortly after. And so that was a gift to him, gift to the family. So I don't know that was that extraordinary, except for the fact that we can hold an intention for what patients need. We hope they acquire, but he was in it. He was in it to a specific goal, and once he achieved that goal, he crossed over. And whether that kind of fits the question of what you asked, I'm not sure, but it's something that happened recently that I thought was just really kind of reaffirmed the reason that we not only try to strive for physical excellence in medicine, but also spiritual goals too. Like, why do you want to stay alive? Why am I in this? Why are you in this? Let's do it together. And what can you accomplish?
That's actually a rare approach. I mean, I've been with my parents as their parents were passing and things like that, and that's not even something that really I heard. Like, I guess we just didn't have compassionate doctors, because that was never like a long-term goal. It was just sort of like, this is your day-to-day care, and this is what's going to happen, and maybe we'll get to rehab, maybe we'll, my grandmother was in a car accident, and that's basically what led to her demise. But she was in the hospital for months. Then they tried rehab. Then they went nursing home. But it was never I never felt like she was involved in any kind of goal setting, and that actually might have helped her, because she would set like little goals for herself, but like it was never like a plan with the doctors.
Yeah,
and
they
stuff.
never said,
no,
you
never.
are getting out of here on this date. That's our goal.
That's our goal.
Or we're getting you to there. Never.
You're
right.
And I think that's
You know,
fantastic
I mean,
that you do that.
That's become, and that's become more and more interesting to me. Like, what's in it for you? Why are you here?
Right.
You know, because I think more and more, and this is separate from me as a spiritual being. It's more, I think this is a very human goal. Like, why are you in it? What is your skin in the game? Because my experience with patients to this point is, if you have a goal, if you are motivated, there are certain goals and timelines that you can achieve. But if you don't have that gusto, it's over.
Yeah.
Absolutely. It speaks to the power of the mind, right? And
Yes.
the mind can will you to do anything. And that's my opinion, and that's what Christina and I have gone back and forth over forever. I've always said my will and my mind is what keeps driving you forward. And
I had a patient this past weekend where they were just so wilted around their will to live.
Mm-hmm.
And I looked at this patient, I said, listen, I can only work as hard as you do. I can't work harder. But if you're in, I'm in. But if you're not, I can't, there's nothing I can do to pull you back from this. But, if you want to live, let me know. And, we'll get this. We're on this. But, I think the bigger story in this is the human power, the human will, to want to live. And I think that carries over into the spiritual too. I mean, there are, the more curious I've become about this over time is, not only our human desire to experience things and to accomplish things, but that spiritual side to have messages communicated, to
Mm-hmm.
live to a certain date, to, if you die prematurely, to come back and communicate something. That force is so powerful that it brings me to my knees, really, when I think about it.
I mean, you can fix what's broken, but you can't fix a broken will. I mean, if the will is broken, you cannot fix that. You personally can't. That has to come from that person. They have to decide they want it. That's huge. And you see that every day, where they'll have cancer and they won't realize it, and they're living their life. And then when they're told the diagnosis, then you can tell that their will has been broken, and they die very quickly after. They've been living their life normally for so long with cancer. They had they didn't realize that's what it was. They were just kind of living life. Mm-hmm. They got that. Suddenly it's a death sentence, and they're done. Yeah. And
which is really stunning, because
yes.
I mean, it's stunning from the standpoint of everything we're talking about here, about being human, about being spiritual, about being ghostly, about being disincarnate. It all centers around what is our central drive and what motivates us to kind of be in this space, either as a human or a spirit. And that's really pretty spectacular.
So what do you hope your book communicates to those who would read it? What are you hoping that someone would get out of it?
I hope it normalizes it. I mean, that's the whole reason that I wrote this book. I mean, I tried not to write it for a long time, mm-hmm. because I think that there were things that I recognized would put me at risk in my career.
Right.
And it was more when I got to the point that the pressure of needing to say something became greater, that I decided to write it. And I felt like I had something to contribute to the conversation that was important. And originally I wrote it to doctors, and my husband, who has experience as a writer, said that may not be your best approach.
Yeah.
He said that, he actually has some experience working with physicians. He's a psychologist who actually works on physician-patient communication. And he said, my advice to you is not to write it specifically to doctors, but to write it to lay people with the doctors looking over your shoulder. And I think that's wise advice, because I think that gave me the freedom to say things that I really felt, things that I thought were important. And I really felt like I had something important to contribute to patient-physician communication, or any kind of provider really, that was of utmost importance and that really mattered to patients. So that's why I wrote it and what I hope that people get from it.
Yeah, I think it is absolutely beneficial to the public, to people, not to the doctor, to the person like me who's worried. What's left, what is there,
right?
Where is that will coming from? Should I continue to have the will? And if someone like you is telling me, yes, I've had experience after experience after experience with different people telling me these things that they've seen, telling me how it's changed them and how it's changed them for the better going forward, that gives you everything that hopefully that you need, so that when your numbers, when it's your turn, when your number's there, you're able to kind of power through it yourself. And that's what I took from it personally. I think it's
well,
fabulous.
And that really gives me comfort too, that's what you took from it, because, above all, after, being with patients for so long, I am absolutely not afraid to die. And that's not something I was always able to say, but, hearing their experiences and hearing, witnessing patients coming back from the edge and saying, and sometimes being kind of mad at us that we resuscitated them and didn't let them go on to whatever it was they were experiencing. I mean, that has given me confidence that, we've been dying for a very long time, and I think it's going to be okay.
Well, we have about 10 minutes left, and this is our paranormal experience tonight. And so I cannot let you out of here without, we have had a conversation in the past, Christina and I, and, we've had a couple of paranormal experience podcasts, and we've talked about haunted places. And she and I are under this under the belief that graveyards really aren't that haunted, that hospitals have to be one of the most haunted places around. So we'd even said we need to get a long-term nurse or a doctor in here and have them talk to us and kind of give them some stories about things that might have happened in their hospital. So now you're on the hot seat, and
oh yeah,
and we would like to talk to you about. You've been at the same hospital for 27 years, 20 years. You said
20. It's almost 20 years. So I've been
almost
19
20 years.
Yeah.
You have a housekeeper there who obviously sees stuff. She sees what's going on. She knows something's happening. What kind of experiences have you had?
Okay, I've got some to share.
Awesome.
Yeah. So we actually do have So I work in a 2-hospital system. They're separated by about 30 minutes in the same metropolitan area. And in one of our hospitals, there was an expansion of hospital rooms to a different part of the hospital. And those rooms that were vacated were now offices or storage, and they are no longer used by patients. And there is a room where some of us have had some experiences, me included, that when you are in a hospital and you're in a bathroom, you'll see a cord that if you're in trouble, you can pull it. I don't know if you've ever seen that. Okay. And a light goes off somewhere, an alarm. So there is a room like 247 in the corner on this vacated office room that every now and then that light will go off, and it is, it's connected to alarms and pagers. And people will go there. And now we're at the point of ignoring it, because every time it goes off, we know nobody's in there. And they've tried disconnecting the cord, like cutting the electronics, and it still goes off that, someone's in there or somebody needs help. And so that's one case. And, there's an operating room at the other hospital, operating room 1, that is not even used for surgery anymore because people, things happen. Things move. And so now it is a place where we store extra ventilators. So if we have run out of ventilators and we need one, people, our respiratory therapist will say, I'm not going in there by myself. You call security because things move, things are thrown, things scoot, things. Yeah. And so, we'll kind of, especially at night, we'll kind of all go in there together, grab a ventilator, get out of there real quick, and go back to the intensive care unit where we use it. But yeah,
you literally have to go in packs. You have to go in packs to the operating room.
Yeah. And I actually, the office where I work in one hospital, it's a hole in the wall. It used to be a closet, and now it's been, converted into an office. And it's a strange little space, and I always leave the door open because it's a little uncomfortable. And every now and then, the door will kind of move. It has one of those Venetian blinds kind of thing that that goes over the whole glass door, and every now and then it'll kind of sway, and I just kind of keep the door propped wide open with I'm so comfortable and at ease with spirit, but nobody likes to be surprised,
right,
and caught off guard. And whenever I'm doing my daily work of taking care of patients, I don't like to be surprised or caught off guard with things that I don't know. And you're right, in hospitals things happen.
That's incredibly funny to me that you feel uncomfortable telling stories about near-death experiences, but you all walk in packs to the operating room because you realize that it's haunted. So it's okay to talk about a haunted.
Exactly.
How did you justify that to the hospital administration, saying we can't use that operating room anymore? How did they determine? We're not going to use it.
I mean that preceded me, honestly. I mean, it's been that way. Yeah. This hospital is 150 years old.
Oh my.
And as long as I've been here, almost 20 years, that operating room 1 has never been in commission. And, there's a part of me that would just love to shut the whole hospital down and do a ghost hunt. But,
oh my God, I would love that. I would
Wouldn't
love
that be great?
We would bring our daughter in there. We would have our ghost hunting gear, and we would talk about it. We would have a podcast on it. I guarantee it.
Oh, that would be amazing.
Because I know Christina, when she was pregnant with the children.
Well, just Sam. When I was pregnant with Sam, I was on hospital bed rest, and I was there for a few months. And you could hear the noises. I mean, for me, it almost felt like a difference from the real people that were out there walking in the hallways and talking and stuff to not so real people that my door would open. Yeah, you're like, why is my door opening? Because I was just there. I was monitored. The belly was being monitored, so they didn't come in and bother me a whole lot, unless they saw a lot of contractions or whatever. So it's not like they were coming in and taking my blood pressure every hour or anything like that. So during the night, I was pretty much left alone, but sometimes my door would just open, and I'm like, well,
that's
not supposed to happen. And just,
there's
I don't know.
Presence.
Yeah, you could feel, it felt weird.
She used to tell me that all the time.
Yeah, there's presence. Yeah. And, we hear that from patients too. And, even in our intensive care unit, you think about people who have died in there. There's a room now that, lights come on and off. The water comes on and off on its own.
Oh, wow.
And it's always the same room. And, I don't know. I have the habit of, and I know we're almost out of time, but I have the habit of just kind of protecting that room. Because, whoever kind of, slipped their physical body in that room and is a little disconnected, they don't really have a place to impact the healing of what's going on in that room at this moment. And I, in whatever, power we all have to say, be on your way, be well, go to the light, go to good. Please do not impact the what's going on with this patient at this time. I think, those of us who are in tune need to claim that and, help both sides, really.
Yeah.
Have you ever gone that far before where you actually find yourself talking to whatever it may be in that room?
Every single day.
Yeah.
Honestly. Yeah. I mean, whether it's true or not. I mean, I feel an obligation as a physician to be able to say my intention is to provide the best possible care I can for this patient who is alive in this room right now, and to do service to those who are not. So, I mean, it has become, my daily intention, my mantra, my positive focus as I go throughout my day to help, whoever I can and cannot see.
Well, I will extend this offer to you. If they ever feel, for whatever reason, they need to close down for a couple of weeks to renovate or whatever, and you can slip us in, please shoot us an email here, provemewrongcast@gmail.com, and let us know. And I would be there for sure.
We're on it. It doesn't cost that much to fly to Appleton. It doesn't really.
That is.
Yes.
We've never been to Wisconsin.
That's right.
Yeah, it's a great place.
That's true. We thought about it once. We were going to go to the Dells.
We were going to take the kids to the Dells.
But we
Yeah,
never,
that's also a good time. But yeah, if it ever happens, I will let you know. That would be, that would be very exciting and also in service to your mission and to mine.
absolutely. Well, thank you so much, Doctor. I really appreciate it. It's been everything I was hoping for and more. I'll be honest with you.
Oh, great.
Thank you so much. I know you're really busy. You've had a lot of training and stuff like that going on. That's kind of why we had to postpone our talk initially. Do you make book signings or appearances or things like that you wanted to mention, or is it just for more information, look at my web page?
Yeah, pretty much my webpage. I mean, I'm very involved in providing patient care, and that's what I'm about right now.
Mm-hmm.
And probably will be for the next 10 years. So I wrote this book, contributed to the conversation, and it's kind of on its own journey. And, as people like you find their way to me, I'm happy to talk about it, but I'm not
Awesome.
actively promoting it.
Awesome.
Yeah. So, like I said, whenever I read your website, I felt compelled to reach out to you because I get lots of requests every day to speak on podcast or
Sure.
write about it. But I just felt like there was something really authentic and true about what you were about, and I wanted to connect.
Well, thank you so much. I really appreciate that. That's nice to us.
Yes.
We really looked forward to this, and it did not disappoint for sure. So,
That's great.
So just for a recap for everybody else, the book is called Near Death in the ICU, and Dr. Laurin Bellg, her website is Laurin Bellg, BELLG.com, and apparently she's on a good long way till Near Death in the ICU too, right? You've got a lot more stories you've already been collecting,
Oh,
right?
yeah.
Absolutely.
Absolutely.
I would love to hear them, that's for sure. Thanks so much. We appreciate it, Doctor, and we hope to talk to you again soon.
That sounds great. Have a good night.
Thanks, you too.
Bye-bye.
Bye. What do you think about that, Christina?
How
was
think
that?
I feel bad that they can't talk about things like that. The stigma? What is the stigma? Is it you're afraid you're going to get called a quack or something?
I don't know. I think I mentioned it to you before. I think that some of it is...
Because I think it's silly. I think it is part of the care. I think it should be part of the care routine.
But I think some of it is the fact, again, like we had mentioned before, that maybe once you get to a point where the more and more degrees you get, the more and more scientific you become, the more and more legislated you become, you can't believe anymore in something that you can't weigh and measure and quantify. And to her point, she couldn't even describe what it was that was changing in the room, you know, and that's difficult, especially for doctors who are really analytical by nature. You know, everything has a measurement and a weight, and they know what it is. Right. And so when you get hit with something that's you have to believe. But
I just find it hard to believe that they just don't have these on the daily. That it would be so taboo to talk about. It blows my mind. I guess I've never had a fear of saying what I need to say, I guess.
Well, you know, and we've heard that before in the previous podcast. It was with Dr. Bruce Solheim, and his was more that he was worried about telling his sensitivity to his colleagues for fear of ruining his career. Right. So I don't know if maybe it's just the academic fields.
It must be.
The farther away you get from the spiritual and, like she was saying, you know, kind of the voodoo traditions.
But it's not voodoo. It's life. I mean, it's literally life and death. I mean, and they're in the business of life and death.
Yeah.
Why wouldn't you share your experiences so that, I mean, even if they're just, I mean, that's how we learn, even from back in the day, is storytelling. Mm-hmm. So you shouldn't be afraid to tell your stories.
I agree.
That's how you're going to learn these things.
I don't see how it is a negative, but we're not in that situation.
That's right. We're not.
You know, so it's hard to say if you were in a situation where it was frowned upon.
That's true.
To give those alternate theories. But I do think that it sounds to me like those experiences have really changed her. And I was going to ask that question, how has this changed you? But then she answered it for me when she said, you know, I'm not afraid to die. Mm-hmm. You know, I've seen what happens. I've heard the stories. I've seen people come back and tell me what they experienced. I'm no longer afraid to die. So to me, that's how it changed her. That's how doing what she's done has changed her. And I think, if I had been in
think
that,
a lot of people could benefit from that.
absolutely. And
And I think that is part of the reason some people go so violently or bad, because they are so afraid.
mm-hmm.
But if people shared more and talked more about it, maybe we would be less afraid.
Maybe that's what I need, is to run a rotation for about 5 years in an ICU. I mean,
Is
seriously.
that your new thing now?
No, I'm just saying. I mean, maybe that's what I need, because the fear in me of that inevitability is strong.
I know,
the
and
fear
that's
is
scary.
strong
I think
in this one.
your death might be violent because of that.
I will fight.
You will fight
I will
hard.
absolutely fight. And I wasn't kidding when she was telling the story about the guy waking up and saying, "Why the hell did you stop working on me?"
Yeah.
That'll be me. I will will myself back,
Will my
and then
life.
I'll bitch at the people who thought I was done. You thought I was done?
Have you not met me?
You obviously have not met me. I could see that being me. It would be violent, and it would be a fight. Yeah. And I would be then in room 247 pulling the damn cord, trying to get assistance, for 100 years after the fact. How awesome is that? How awesome were those? Those were good stories.
I like that.
I knew we could get some good ghost stories from a hospital.
For sure. God, you could just tell being in them sometimes. Walking down the hallway, it's kind of sometimes you're like, wait, it feels like there's somebody behind me.
There are some places that feel really damn creepy.
Yeah.
In a hospital.
Yeah, always.
But
always.
I wanted to ask her, but we just sort of kind of run out of time. I wanted to ask her kind of what she felt about, did she believe in reincarnation? Does she believe, how does she feel? What is the eventual impact of these things that are in these rooms? What's going to happen to them? What happens? Are they waiting for another go around? Or are they just stuck there?
I don't think
that's the question.
That's a good one. We don't know that.
Right.
That's a long question. That's been happening for years.
Right. But for them to have to walk in groups,
right?
Doctors, medical professionals, people with PhD next to their name.
Hey, will you accompany me to operating room one?
It just shows you.
Afraid.
It doesn't matter how many damn degrees you have. You're still 12 years old when the room is haunted. You got to get all your buddies in there and roll into the operating room so you could grab some syringes or some gauze because you're afraid. That's fabulous. It doesn't matter.
I'm sure it happens.
How many degrees you have means nothing when we're talking poltergeist. That's fabulous. Things are flying around.
Yeah.
Oh yeah.
Poltergeist too. That's
she
crazy.
said things were flying around.
Now that's pretty intense.
That's excellent. I can't tell you how much I want to go there. I want to go into that room in the worst way, and take Laurin in there, scare her ass a little bit. Oh my God.
Doesn't scare her.
That's why I want to do it.
Good luck.
I want to see how she feels about it.
That was good.
It was great. Good. I thought that was great.
Yeah.
What are your thoughts? What are your thoughts out there? Do you believe in near-death experiences? Do you think it is maybe just kind of the last-ditch effort of an oxygen-deprived brain, something that's actually dying, and then maybe those medical professionals are able to pump some life back into you, and you come back out of it, and you still remember that your brain still had some level of consciousness? Is that what it is, or are you actually looking across the veil of some kind, seeing a loved one, seeing people that you've missed or that have been gone for a while? I don't know that we really know. It's a question that's been there forever. I don't see it going away, because as long as we all have faith, we're going to continue to want something more.
That's right.
Nobody wants it to be it, and that's it. We all want something more. Even those people, you out there saying, I don't believe in the afterlife, you're lying to yourself. You want to believe in something. You don't want to just say, that's it, there's nothing else, and I'm done. You're lying to yourself. I have a hard time believing that. I think everybody...
I can't even fathom that.
Right.
I can't even fathom people who say that is real.
Right.
Like, I so wholeheartedly believe that there's something, and it's not even something that, like, I feel like I was taught or told. It's an actual feeling. I feel that there's something beyond this, and you're not going to talk me out of it. I don't care. Religion-wise,
right?
No, it doesn't even necessarily transcend that. It's a feeling, and I have it, and it's there, and you're not going to talk me out of it. So
I'm not going to talk you.
No, so I just don't understand how people are like, "Oh, that's it," and I'm dead, and I'm no, really? You don't? I just want to be like, really? You don't feel that?
It just seems like life.
There's like a pull. Come on, people. There's something else there. You don't feel it around us.
it just seems like life would be so pointless if that was true. It would be so meaningless and pointless, and I don't want to live in a world with no meaning. I don't want to live a life where there is no meaning to it.
Well, yeah, and then there's also, I mean, that creates chaos if there's no meaning.
Absolutely. I mean,
can you imagine how just reckless people would be?
Right.
No thanks.
I can imagine it, but I don't necessarily want to. That's for sure. So again, we went off on a bit of a tirade,
Sorry.
a bit of a rant again there. That's okay. You can be relaxed. I can move the camera as needed. No big deal. We have high production values here on the Prove Me Wrong podcast. But again, if you have any questions or you have any comments or you've had a near-death experience, we would love to hear it. I'll tell it on the podcast. We'll talk about it. That would be fabulous. I would love to hear what it was, how it changed you, how you've lived your life after the fact. What meaning did it give you? Those things are things I'm searching for personally. I've never had, thankfully, haven't had that experience yet where I'm that close to death.
Oh, are you kidding?
What? I mean, you think I have?
Oh, yeah.
When?
You've been when you were younger in a car accident. You should have, after seeing the car and what happened there, you should be dead. There's no way. And you walked away with some glass in your arm.
Well, it was a bad accident, but I don't know that I was never at any point where I was injured. I was not injured.
You were not, but you should have been. That's near death. That was a near death experience.
Maybe.
There's been times when we almost died on the way to the hospital with Sam. Oh my gosh, we were going 60 miles an hour. If we would have hit the back of those people, we would have been dead. Instead, you swerved and we missed it. That was a near death experience.
No, that was.
Granted, I was in labor, but
that was just a demonstration of my cat-like reflexes,
babe,
and ass-kicking mental abilities.
Okay, but if those didn't exist, we would be dead.
If you had been driving, we might have been dead.
Probably.
I'll put it there.
That's probably an accurate statement.
You're derailing me again.
I'm sorry.
So, okay, so again, if you have anything like that, other than, let's just constrict it to, hey, you were really dead, and then you came back, or something similar to that.
You coded.
You coded, right.
Okay.
Contact us. ProveMeWrongcast@gmail.com. That's the email address. You can find us on Facebook, on Instagram, Prove Me Wrong. You can search Prove Me Wrong. You'll find us. If you just want to hear the podcast itself, you're looking for content, we are on any platform that you whatever your preferred platform is, whether it be Tunein Radio, Stitcher, Spotify, SoundCloud, iTunes, anything like that, you can find Prove Me Wrong.
But if you're watching us on YouTube, hit subscribe.
There it is. Go ahead, show it to them. But if you're watching us on YouTube, there's the like and subscribe right there on that scroll at the bottom of Christina's screen there.
It's not there. There it is.
There it is. There it is.
There it is.
Yeah. Like and subscribe to the channel, and then you will be the first ones to be notified when new content comes up. It's just that easy. So for Dr. Laurin Bellg and for my co-host, Christina, who graced my presence today, it was very nice. It was good to have you here. A lot of these interviews are just me by myself. I love having your impact as well.
Thanks.
And before we go, this episode of the Prove Me Wrong podcast is brought to you by ZendoZones citronella burners from JT Eaton. They are shaped like fearless little bug-repellent tiki gods. So let's surf and stand, Hawaiian Howie, and Luau Lily bring the islands to your door with ZendoZones citronella burners. ZendoZones uses natural 3% citronella candles and incense cones, perfect for patios, decks, backyards, campsite, poolsides, haunted hospitals.
Yeah, sure, why not?
And more. Absolutely. You can enjoy the outdoors again. We may never enjoy that operating room again.
No.
They are available on Amazon and at Ace Hardware. And I'm really trying to get this Prove Me Wrong podcast discount going. So if you buy something online or at Amazon, say the Prove Me Wrong podcast sent us. See what happens. Maybe they'll give you 10% off. I don't know. Probably not. But
free incense
it's my new national campaign that I'm starting. Good product. We use it, and we recommend it. So once again, for Dr. Laurin Bellg and for Christina, I'm Pete Lieb, and this has been the Prove Me Wrong podcast. We'll see you again soon.